The country's sluggish investment into production and delivery of oxygen could be blamed for shortage of oxygen in the country that has critically hampered the handling of COVID-19 cases at a time more severe disease is being reported. Now, a critically ill COVID-19 patient may require up to 4 cylinders of the 8,500 liters a night, becoming an expensive disease to manage and of lives threatened by the uncertain supply of the crucial gas. Sam Gituku looks into the rising demand of that could separate between life from death for many.
Recently, Health Cabinet Secretary Mutahi Kagwe declared an oxygen crisis in a country whose oxygen demand has doubled in a year to hit 880 tons in the month of March. At the time, Kagwe blamed hoarding of oxygen cylinders by private Kenyans, hospitals and other facilities. But it may not hit home until one understands how important oxygen is, a gas that is ordinarily naturally occurring. Dr. Victor Ngani takes us through different CT scans of COVID-19 patients' lungs of different grades from moderate to severe.
My task as a doctor is to keep you alive for the period of time it takes for your lungs to heal. And then some of these maneuvers also help your lungs to heal.
For patients that can still breathe on their own, oxygen supplementation of different levels can be a sufficient therapy to keep their blood oxygenated as they buy time for the body to fight the virus.
From the very top, you can see what looks like clouds. These are areas affected by the virus, and it's quite extensive.
But for critically ill patients, they would require to be put on a ventilator.
This patient is currently on support in terms of a ventilator to try and force air through these tiny spaces.
Currently, the country has 236 patients in ICU facilities, 53 of them on ventilators. Another 253 patients are receiving oxygen supplementation at different wards. At this RFH healthcare facility, 12 patients are in ICU and HDU, a dozen more are on supplemental oxygen, making it necessary to have piped oxygen where different patients can share the supply.
On a good day, you may get oxygen for about 3,000 shillings. On a bad day, you get it for 5,000. A patient using 3 or 4. So you can imagine that bill is almost 20,000.
The facility has now had to, on a daily basis, procure oxygen for a constant flow. Such is the story for many public and private facilities. For a country that has 73 oxygen plants at national and county facilities. The announcement by DevKi Group to donate oxygen to all health facilities has attracted many customers. At the oxygen gas plant in Ruiru, the level of activity has gone up since the last week of March as staff and machines continue to tap air from the atmosphere, compress it, cool it, purify it, before methodically filling it into waiting gas cylinders to various hospitals.
I can see it is 5 times more than the requirement what was in the month of December and January or in November last year. So it has gone minimum 3 to 5 times more, and now we are overwhelmed by filling the cylinders in all our plants for the hospitals, and we will continue until we have no limit, no cap that it will be for 100 million, it can be for 200 million, for any amount we will give the oxygen free of charge.
Health facilities have to follow the usual procurement process and start by applying for donations from DevKi. From the records, several hospitals have been making orders on a daily basis, including KU Teaching, Research and Referral Hospital, Karen Hospital and Muranga Level 5 Hospital. When we visited, vehicles from Muranga, Kitui and Nyeri were on the queue for the daily dose of the cylinders of life.
I don't think so. It should cost more than 100 million shilling to put a good, nice 100 to 200 million shillings to put a nice size of oxygen plant for a level 5 hospitals.
Others, however, estimate it could cost as low as 14 million shillings for an oxygen plant sufficient for moderate-sized hospital. At the Kisii Referral Hospital, the demand for oxygen has shot up. Ordinarily, the oxygen plant there serves up to 5 counties. They have now had to only release the excess supply they produce. Electricity supply has been inconsistent and oftentimes hampers production. And at the nation's largest referral facility, KNH, the demand for oxygen has equally doubled to 8,000 litres of bulk oxygen, forcing the hospital to scale down on surgeries. For now, over 400 patients are depending on the precious cylinders to live another day to fight the virus. For slightly over a week now, the machines behind me have been running for longer than they used to, as more and more facilities come calling in need of oxygen supply. But it raises questions over the country's priorities in building the capacity of oxygen production at a time the facilities would need it more conveniently in the counties near them. Sam Gitukusrize TV, Ruiru, Kiambu County.